Dialectical dilemma is basically when a client is stuck at the extremes. So binary extremes leading to dysfunction. With trauma survivors, this occurs in 5 distinct areas. The areas of awareness, thinking, emoting, reacting, and relating. So in each of these domains, trauma survivors end up with responses that are either too much or too little or both. For example, with awareness, trauma survivors end up with both overawareness and underawareness. In clinical terminology, that would be hypervigilance versus dissociation. Trauma survivors also end up with both overthinking and underthinking, or in more clinical terminology, obsessive rumination versus impulsive decision-making. Trauma survivors also end up with both over-emoting and under-emoting. In other words, emotional overwhelm versus emotional numbing. Trauma survivors also end up with both overreacting and underreacting. So in other words, maladaptive coping versus paralysis. And finally, trauma survivors also end up with both over-relating to other people versus under-relating. Or in other words, too much aggression versus too much passivity.